So I'm Evelyn. I'm a paediatric dietitian who's been working in Leeds for over 20 years in paediatric oncology and haematology. So I've come to try and hopefully give you a few hints about helping to get your child to eat better, both during treatment and after treatment. Getting your child to eat can often be one of the most frustrating things during treatment. It can lead to a lot of anxiety between yourself and your child. But nutrition is really important both during treatment and after treatment. It's important during treatment because the better nourished your child is, the better they'll be able to cope with the treatment we're giving them. They'll have the strength and ability to get through that treatment. They'll be able to fight infections more easily. Any sort of wounds that have been damaged and healthy tissue damaged by the treatment will be able to regenerate and repair more easily. And also, generally, they'll feel better, they'll have more energy to do things and want to do more activities during treatment. And obviously, growth is an important aspect as well. We want the children to continue to grow and develop during treatment, and good nutrition will help them do that. After treatment, nutrition is very important as well, mainly because there are some long-term side effects associated with treatment, such as being more overweight, and obesity are common problems that we see in children treated for childhood cancer. And also bone health as well is particularly important, both during treatment and after treatment. So it is important after treatment to get them back onto a healthy, well-balanced diet. So during treatment, we know why they don't want to eat. It's mainly it can be initially due to the initial presenting disease. Some children present with lack of appetite and weight loss at the beginning of treatment. Others may be okay and their appetite's okay at the start of treatment, but then when we give them treatment, they get side effects such as sore mouth, diarrhea, vomiting, nausea, sore guts, taste changes, which all can have a very profound effect on a child's nutritional intake. And there's also a lot of anxiety around food as well. There's anxiety being in hospital generally, and there's anxiety about the hospital food, which never is that brilliant. There's anxiety around sort of mealtimes in hospital, anxiety about going for tests, investigations, and having to get food in around these times. And also, food is one thing that the child can control as well as the parent. They can't always control the medicines. They know they've got to take the medicines to get them better, but food is something that they can manipulate a bit themselves, particularly in the toddler age group and perhaps again in the older teenage age group. So it can lead to a lot of anxiety. After treatment, some of the issues we see, there may be issues with food aversion. So maybe your child's gone through treatment, they've been quite sick during treatment, and therefore they become quite scared about eating properly again, think they're going to be sick, or they've had a bad experience with a particular food in that they've had their favourite meal and they've been sick afterwards, and they associate that with being in hospital and being unwell and don't want to eat that particular food again. Some children, especially some of the younger children, can become quite tube feed dependent during treatment. Again, they're not eating particularly well. We can help them with nutrition by giving them tube feeding, but at the same time they can become quite reliant and dependent on this, and it therefore can take quite a while to wean them off tube feeding after treatment. And again, even after treatment, there's a behaviour and control element around feeding and what to eat and what not to eat. So first of all, what can we do as health professionals to help your child's nutrition? Again, during treatment, if your child has a poor appetite, they're not able to consume enough, they're losing weight, they've lost a significant amount of weight that we feel is too much, and we need to get on top of their nutrition. We can give them various things. We can give them some nutritional supplements, such as milkshake type drinks, juice type drinks, and calorie supplements to help them. I must say they're not particularly popular in this patient group. We may decide that they've lost too much weight, they're losing too much weight, and we actually need to intervene with some tube feeding. And that can either be through tube feeding through a nasogastric tube down the nose, or a tube placed directly into the stomach, or a gastrostomy. And that way we can be able to get adequate nutrition, balanced nutrition into them, using a feed that gives all the protein, calories, and vitamins and minerals that the child needs. It may be that they've got such quite bad gut toxicity that they're not able to absorb enough enteral feed or enough nutrients through the gut, and we need to rest the gut for a period of time, in which case we can feed them intravenously or give them parenteral nutrition. After treatment, as health professionals, we can support you weaning your child off tube feeding. Again, like I said, it varies the length of time this can take. And it may be that we need to involve other health professionals to help us do that. It may be if you've got a particularly young child who's missed out that weaning phase opportunity because they've been sick and because they've been tube feed dependent, it can take them a while to develop their oral skills back again. So we may ask the help of speech and language therapists to help us to do that. It may be that there's a behaviour element to eating and weaning off tube feeding, in which case we may ask the psychologists to help us with the behaviour element of eating to try and get them back to eating again after treatment. And then again, after treatment, it's important to get them onto a good, healthy, well-balanced diet, so we can signpost you to sources for this information. Again, we sort of know the reason why they don't eat during treatment, the side effects, and there is specific information on side effects of treatment related to eating, such as poor appetite, nausea and vomiting, sore mouth or throat, diarrhoea, constipation, and taste changes. And probably your local dietitian has given you information on this. And also the Helping Your Child Eat CCLG booklet also gives specific information on these side effects of treatment. So what can we do to help you? This is the food safety guideline on what a well-balanced diet should be. So we can see that we've got the largest portion is actually the fruit and vegetable portion, good source of vitamins and minerals. The next biggest portion on the right-hand side is the carbohydrate portion. So that's bread, rice, cereals, pasta. The pink bit at the bottom there is the protein group, so meat, fish, eggs, pulses, important for growth in children. And then the blue section is the dairy product group, so milk, yogurts and dairy foods, important source of calcium for healthy bones. And then the skinny bit at the bottom, the purple bit, is the high fat, high sugar, the treat type foods. And ideally, once your child has finished treatment, that's the kind of plate model we would try and get them back onto. However, during treatment, the plate model might be slightly different. Their appetite's poor. We're desperately trying to get calories into them to prevent them from losing weight. So in actual fact, the small purple bit at the bottom is probably going to be slightly larger at that point in treatment to get the calories in to help them to maintain and gain weight during treatment. So the plate model changes over time and over your child's treatment. So what can you specifically do? Again, there's no magic solution, unfortunately, and it can be very difficult and very frustrating trying to get your child to eat. But there are a few tips that we can give you to try and help you. If they've got a poor appetite and they're not eating particularly well, don't give them a big mountain of food and stick to 3 meals a day. Offer them little and often with a small amount of food on a small plate so they're not overfaced with a big mountain of food. Perhaps take advantage of the time when your child says they're hungry. Take advantage, ask them what they want to eat and offer them more food at that point in time to try and get more nutrition in. Maybe watch things like the timing of drinks, especially in the small children. They've only got little tummies, and if they're filling up in a lot of juice or pop before meals, that's going to limit their appetite for food. So watch the timing of drinks, not to have a big drink before meals are due, and little sips to help wash the food down, and then bigger drinks in between meals. Again, if they're struggling to eat and get the calories in, use energy-dense foods. So go for the high-fat, high-calorie foods to maximise their calorie intake. And maybe cut down on foods that are going to fill them up more at that point. So cut down on lots of fruit and vegetables or lots of fruit juices that are going to fill them up. Sometimes it's difficult. It's maybe you who's trying to get the child to eat, and that can be difficult because of the behaviour aspect of things. They sense you're anxious overeating, so they can play up on that. And quite often we find that maybe they eat better for grandma, they eat better for auntie or whatever. So take that opportunity. It's not always you that has to feed your child. Ask other family members or friends to help feeding your child. Perhaps keep a good supply of sort of ready meals and snacks available. So again, when your child does say they're hungry, you've got things in stock that you can give them. And maybe again, sort of try making milkshakes or smoothies to get extra vitamins and minerals and calcium in that way. Other things you can do, again, mealtimes can be a bit of battleground. So a few tips for mealtimes is maybe limit mealtimes to 20 minutes. If your child hasn't eaten after 20 minutes, they're probably not liable to eat anymore. So don't let mealtimes drag out. Limit it to 20 minutes. Take away the plate at that point. Give lots of praise for what they have managed to eat. So if they've managed to eat small amounts off the plate, say, well done, that's fantastic, brilliant. But then at the same time, don't give negative comments on what they haven't eaten. Just clear the plate away. Try to eat as a family, try to eat at the same time as your child, because again, eating at the table altogether will help your child with eating, rather than eating at separate meal times. I know this isn't always possible because family life is busy generally, but even at one meal a day, or even if they don't eat with yourselves, get them to eat with their siblings, again, because they'll tend to eat a little bit better if they're eating with other people. As I said earlier, don't put too much food on the plate. They can always come back and ask for more if they finish what's on their plate. Maybe encourage them to be involved a bit. Ask them to choose what they want for tea tonight. But limit the choices. Don't give them lots and lots of choices, because that's confusing for the child. And they will go, I want that. No, I want that. I want that. Try to limit the choices to 2 foods at a meal time. And also maybe try and involve them in helping to prepare the meal as well. So they feel like they're getting involved with food and they're seeing food as a fun thing to do. So yeah, going on, so food is fun, and that's an important message to give your child. It's important to ensure that they know food is a fun thing, it's not a negative thing, it's good, it's fun. So involve your child to make simple meals, simple snacks, decorating pizza toppings, making milkshakes, baking buns, decorating biscuits, simple things like that, just to help them to make sure that it's fun. Got a drum competition here. With the younger children, let them make a mess with food. Again, it means it's fun. Let them dip their fingers into the bowls of food and make a nice mess. Let them play with food. Feeding teddy bears, feeding dolls is all good fun. So yeah, for the younger children, things like thinking about having a teddy bear picnic. It doesn't have to be outdoors, it can be in the front living room. Just get a tablecloth or a rug or something, blanket on the floor, invite a few of the child's favourite toys, teddies, put out a few sort of snacky type foods and have a fun picnic in the living room. Again, it will help, it's fun, it will help your child to eat. Maybe again invite a friend to tea, or if not, then their favourite toy. Bring Teddy to the table. See what Teddy likes to eat. Oh look, Teddy's eating this. You try a little bit. So all sort of role play, fun playing interaction with food with your child. Maybe pretend to have a restaurant or cafe, so they think about what we'll have on the menu for the cafe or the restaurant. So they get to choose a bit of that. They can then ask other family members what they'd like to eat at the cafe or restaurant. So again, interaction, fun and play. Peer pressure is always good. A lot of parents comment, oh, they don't eat much at home, but they will eat at school or they'll eat at nursery, because they're eating with people their same size and their peer group. So again, wherever possible, try and encourage them to stay for meals at nursery, stay for school lunches, and have some friends round to eat with them. Another thing we could think about is some kind of reward scheme, especially the younger children quite often respond to rewards. It can be something simple like a sticker chart. So, okay, if you've eaten your meal or a bit of a meal, you get a sticker on the chart. If at the end of the week you've got so many stickers on your chart, then you can have a treat. It doesn't have to be a big treat. It can be just something simple like watching their favourite DVD, or a trip to the park, or a trip to see grandma or whatever. It doesn't have to be a big reward, but some younger children do quite often respond well to sticker charts and rewards. If your child isn't eating well, either during treatment or they're just finishing treatment and they're weaning off tube feeding but not quite eating enough oral calories yet, then again we can help them to get extra protein and calories into the food they're eating by doing what we call food fortification. So doing simple things like going for full-fat products, so using full-fat milk and full-fat dairy products to get more calories in that way. Doing simple things like adding extra butter, margarine to things like bread, potato, crumpets, chapatis, etc. to get more calories in that way. Adding extra cheese on top of pizza, grating it and adding it into pasta dishes. Adding extra grated cheese to things like tinned spaghetti, baked beans into soups and letting it melt in. Adding olive oil or a bit of oil into pasta as well can help increase the calorie content. Doing things like adding cream, creme fraiche or ice cream to dessert. So if they're having some tinned fruit or some fruit, maximise the calories by adding cream or ice cream to it. Add cream to things like porridge, soups and milk puddings, and add mayonnaise to things like sandwiches and jacket potato fillings can all help to increase the calorie content of the diet without them having to eat extra food. Fruit and vegetables is always a big issue, both during treatment and after treatment. Again, during treatment, because the taste changes and the lack of appetite, Sometimes we find children maybe only tend to concentrate on 1 or 2 foods, and the diet isn't that varied. If they're actually consuming enough calories, they're eating well, and they're not tube feed dependent, then it is important to try and include some fruit and vegetables in the diet. And sometimes you may have to disguise it a bit and be sneaky, and obviously so they can't realise there's some vegetables in there. So try and include some fruit and vegetables with each mealtime. It can be, just move around the corner. It can be fresh, frozen, tinned or dried. It doesn't matter. Nutritionally, it's just as good. Good ways of disguising it, though, is by chopping up very fine bits of vegetables, adding it into things like soups, and then blending it, obviously. Adding fine chopped vegetables like into stews, curries, pastas, adding extra tomato puree on top of pizza and pasta dishes, mixing maybe a bit of mashed carrot or mashed swede into mashed potato. And then quite often children like roast potatoes, so why not roast some carrots, roast some parsnips or some sweet potatoes? Maybe try adding some vegetables in with stir-fries and stir-fried rice. Most children like pizza. Try adding different toppings, like extra tomato, pineapple, mushrooms and sweet corn to encourage vegetable intake that way. I think they're coming through the door now. Fruit kebabs is a good way. A lot of children actually respond quite nicely to fruit kebabs. Getting a kebab stick or skewer and adding on, maybe doing some melons, some grapes, some strawberries on a kebab stick and getting to eat that way. They quite like that. Quite often children like sort of crunchy things they can hold as well, rather than using a knife and fork. And quite often children quite like crunchy things, so doing things like carrot sticks, cucumber sticks and peppers will help as well. Another good idea is don't hide the fruit bowl in the kitchen. Have it somewhere in the living room where the child's walking past frequently. Make it nice and colourful for them to look at. So they see this nice colourful bowl of fruit and think, oh, I might just try something, we hope. But that's there, so don't hide the fruit away. Another aspect of both sort of during treatment and after treatment is bone health. There is an increased risk of bone abnormalities in children both during treatment and after treatment as well. They have an increased risk of both pain, or what we call osteopenia, and increased risk of brittle bones and fractures or osteoporosis. Some of the risk factors around that include the steroid treatment that we use, methotrexate, reduced physical activity, although Liz has now got them on board doing their exercise, and also nutritional disorders of vitamin D and calcium. So again, if they're not eating well, they may not be getting enough calcium or vitamin D in their diet, especially if they're not on tube feeding or supplementary drinks. Vitamin D, you've probably read quite a bit of vitamin D in the press generally about the general population's vitamin D levels being low. And that's because we get most of it from the action of sunlight on the skin. And because we're in the northern hemisphere, we only get good vitamin D levels between April and September. And if we've had a poor summer, we don't get much at all. So that's the main source of vitamin D. There are some dietary sources of vitamin D, including fortified margarine and fat spreads, fortified breakfast cereals, oily fish such as mackerel, tuna, herring, sardines, salmon. Eggs are a good source of vitamin D, and full-fat dairy products. However, in quite a lot of centres now, we actually measure your child's vitamin D at diagnosis and throughout treatment. And if the vitamin D level is low, we will recommend and give you a vitamin D supplement for your child to take to maximise their bone health during and after treatment. The other main nutrient that's important for bone health is calcium. Good sources of calcium in the diet are the dairy products, so milk, yogurts, ice cream, mousses, good sources. A few non-dairy sources include green leafy vegetables, bony fish, because the very fine edible bones are high in calcium, although not many children like things like sardines, pilchards and herrings. Dried fruit, seeds, pulses and fortified foods with calcium are good sources as well. So it is important to try and ensure they're getting good calcium intake both during treatment and after treatment as well. So for further information on just sort of general eating problems during treatment, then they've left copies of the CCLG Helping Your Child Eat booklet over there for anybody who wants a copy. After treatment, a good website to refer to is the one that Liz put up early, the Change for Life government website. As well as giving information on exercise, they give a lot of information on healthy eating, both for children and families, so it is a really good, useful website to go on. Thank you.